Okay, good morning, everybody. This is Jeff Spring at the Department of Commerce, and welcome to the August edition of the CHG Lead Grantee Monthly Webinar. This is a webinar that we've been holding on a monthly basis. It's the fourth Thursday of every month at 11 o'clock in the morning, and this is a venue for CHG lead grantees to have a candid conversation with one another. It's a safe place to discuss emerging best practices, concepts, new ideas, maybe do some troubleshooting and problem solving. Today, the webinar is going to be focused on the topic of prioritizing unsheltered clients, and it's hard to have that conversation without talking about the very related and connected topic of diminishing emphasis on homeless prevention. So those two topics are kind of inextricably linked. Today we have Tess Colby from Pierce County and Caleb Luther from Cowlitz County to talk about their respective communities move away from homelessness prevention and kind of doubling down on prioritizing vulnerable populations, particularly the unsheltered. And if you were lucky enough to be in Spokane at the Alliance Conference in May, you might have seen Tess and Caleb present pretty much the same presentation. So here's a replay of that. Tess, I'm going to make you the presenter so that we can see your screen.
Okay.
And there you are. You're live. Take it away, Tess. You've got for about 30 minutes.
Okay, great. Thank you, Jeff. And my apologies in advance if my voice sounds like I'm in a cave. For whatever reason, I'm having some technical difficulties. So I will speak as loudly as I possibly can without sounding like I'm shouting at everybody.
You sound great right now.
Okay, thanks. So thanks again, Jeff, for inviting me to present. It is a little bit of the same presentation that I gave at the conference, but I changed around the slides a little bit to make them more interesting, so hopefully that will help. So my goal here is to just walk folks through our process in Pierce County to get from using resources on prevention to moving those resources downstream, if you will, to actually doing diversion of folks who are literally homeless. So I'll dive right in it. So in Pierce County, our path from prevention programs for people who are unstably housed to diverting people who are experiencing homelessness really started with what we learned from our first version of coordinated entry. We launched coordinated entry in 2011. We refer to it now as our version 1.0 because we're currently changing to version 2.0. And in that version 1.0, we included some resources to provide prevention assistance for people who were at risk of becoming homeless within 2 weeks. And so that fits HUD's category 2. We had a whole lot of takers, lots and lots of takers. Since, as we, all of us know, there are a lot of folks out there who are unstably housed in all of our counties. The volume of calls actually was so overwhelming, it literally disabled the phone system that was in place at the time. And nevertheless, the coordinated entry staff were able to provide 210 households with prevention services at a total cost of about $230,000. So about roughly $1,100 per household. And I wasn't here at the time that the county was doing these prevention services, but what I understand is that the coordinated entry providers blew through those prevention dollars in 6 or 8 months. In addition to funding prevention through coordinated entry, the county had also, since around 2004, been funding a variety of prevention programs with ESG, with HBRP and ESG. And so what we did was we went back and we looked at the outcomes of those prevention programs. We were curious whether or not folks who received prevention assistance had come back to us as homeless. So what we found was that of all the households that received any kind of prevention services, about 24% returned to homelessness. And so that sounds pretty good, right? I mean, that can translate to a success rate of about 75%. But the problem was for us that the magnitude of the calls from people at imminent risk of homelessness far outpaced our resources, and we weren't able to provide housing resources to every single person who was literally homeless. So way more people than we could help who are unstably housed, and way more people who are literally homeless than we had resources for. I mean, that's the familiar tale that we're all dealing with, right, which is that the demand for our services exceeds our supply of housing and support services. So we decided to dig in a little bit deeper into the coordinated entry data to really better understand who was getting services, who wasn't getting services, and then what we could learn from that. So here's some of what we learned. In the early years of coordinated entry, before we expanded our rapid rehousing program, so that's really pre-2014, coordinated entry received about 4 calls from at-risk households for every 1 call from a literally homeless household. And because of the limited resources, and at the time we had a really heavy reliance on transitional housing, only about 20% of literally homeless households actually received a referral to a housing program. And that's really because the vacancy level in transitional housing, which again, pre-2015, from 2011 to 2014, transitional housing was the backbone of our system. That's really because, you know, as those of you who are still operating transitional housing programs know, there aren't a lot of vacancies that come open in transitional housing programs in any given year. So, you know, in actual numbers, it was that about on average, coordinated entry was receiving 1,100 calls per month, and that's not unduplicated. Those are duplicated calls from month to month and sometimes even within the month. But about 250 of those calls were from literally homeless households. And we really, at that time, only had around 50 housing program vacancies each month. So you can see that it was just a really tight funnel down to actually get to a housing placement. So, you know, that piece of data confirmed a little bit of what we already knew intuitively, that there's still a lot of housing instability in Pierce County, which means we still need to be working, all of us, on increasing the supply of affordable housing. We don't really have enough housing options for those who are literally homeless, but it also confirmed for us that we really needed to take a deeper dive into how we were investing in housing solutions and realign our housing investments with the demand and the need that was out there, which of course led to a complete dismantling of transitional housing, which is of course a whole other separate webinar. So we also looked at our wait list data that we had been collecting, and here's some of the other information that we learned from the wait list, which is, on average, we were losing contact with about 1/3 of the people on the placement roster. So either their cell phone got disconnected, or they didn't return calls, or they just didn't make their assessment appointment. Around 20% of the people who had been put on the wait list found housing on their own. And that was really important. That was a really important piece of data for us because it really speaks to the resiliency of people in crisis. Only about, as I said, 20% of folks were getting actual referrals to housing programs. And the remainder of the people were placed on our wait list. And the average time on the wait list was around 116 days in 2014, which is, you know, obviously way too long to remain homeless waiting for a housing placement. So finally, we looked at what happened with the people who were literally homeless, who were literally homeless but who never got a referral to a housing program. So those people who either they self-resolved, or we lost contact with them, or they remained on the wait list. And what we found was kind of interesting. We thought only about 23% of those folks that basically didn't get served directly by us came back through coordinated entry seeking services again from us. Now there's probably a bunch of reasons why that is, but we hypothesized that some percentage of those folks, since we knew that about 20-25% of folks were self-resolving, we made some assumptions that that percent might be higher, which is what led folks not to come back and keep coming through coordinated entry looking for services. We also thought to ourselves, there's not really that big a significant difference between what happens when we don't provide prevention services and when we do provide prevention services. So I mean, it's about a quarter of the folks are coming back to us saying we need more services. So we also did sort of the standard research, I guess. We looked at other prevention programs across the country, and what we were finding really footed well, really matched well with other research on prevention, which really a lot of the research on prevention across the country and other jurisdictions tells us that that prevention assistance, particularly financial support, is the most effective when it targets people who will actually go on to become homeless. It also tells us that there are no predictive indicators of who will go on to become homeless. So given that we want to be as close to the homeless crisis as we possibly can with prevention, and we don't know, we can't look at a group of 10 people who are unstably housed and pick out the 2 who are going to become homeless, we decided that it made sense for us to really move those prevention dollars and that prevention activity downstream to assist folks who are literally homeless, to help them to avoid coming into our system and potentially having a very long, protracted wait for services. So we did a pilot because, we wanted to keep kind of testing this diversion concept. So in late 2014, we started a pilot program, that revolves around a problem-solving approach to help divert families from having to be placed on the wait list. When I say problem-solving, what we do is we utilize a conversation that basically helps people to mine their own natural supports and resources to help them get back into housing. In 2015, about 235 families were able to reestablish their housing within 30 days with very light assistance. So these are families that were literally homeless. They either were in an emergency shelter or they were unsheltered, coming to us through coordinated entry. So that's about 35% of the families who came to coordinated entry. And we've tracked them over time, and we are finding an average return to homelessness rate of 5%. Families get a combination of financial assistance and non-financial assistance, and the non-financial assistance is usually, it typically starts with conflict resolution, helping them either to resolve conflicts if they are currently staying someplace so that they might be able to stay there longer, or help them negotiate a recovery or renewal of their lease with a landlord. But it also includes, what little we can do in terms of housing search assistance, job search assistance, any other kinds of legal issues that we can do within that 30-day period. And it's important to keep in mind that the commitment really is to have a conversation that results in a realistic solution that can be achieved in 30 days. What we like about diversion philosophically is that it answers the but-for question. So that question is, but for our assistance, would these folks still be homeless? Would their homeless episode be prolonged? And we think that with diversion, we get a solid yes, that because we're addressing the homeless crisis itself, we feel like that question gets answered for us. So we liked the outcomes from this pilot program well enough that what we've done is we've incorporated it into our coordinated entry process. And really what we're trying to build right now in our crisis response system is that problem solving is a key component all along the course. At every interaction with an agency or with coordinated entry, there's always a focus on problem solving and resiliency and helping folks to really, focus in on the resources that they bring to resolving the crisis. So we're, as I mentioned earlier, our coordinated entry version 1.0 was fine as it was, but we, like a lot of jurisdictions, are moving basically over to an assessment tool that's based on vulnerabilities and housing barriers. And so since we were making that change, we took opportunity to go back and do a full relook at our coordinated entry. So just quickly, kind of what our coordinated entry looks like now is that as soon as somebody comes to a coordinated entry, the very first conversation that everybody gets, all households, not just families, but singles and households without children as well, they get this problem-solving conversation, if you will, and with the goal obviously being they're not having to be placed into either a priority pool or referred back to mainstream services without some light assistance. So just quickly, kind of what the nuts and bolts of our problem-solving approach. The only real common denominator across these conversations is that they're creative and that they are absolutely unique to each client that's served. So the model we use follows a dispute resolution process where the case manager is neutral and guides the client through a conversation by listening, by asking powerful questions, non-judgmental questions, by summarizing and handing the conversation back to the client. And then the client is really supported in coming up with creative options. And those options are reality tested so that the client has a better opportunity for success. There's no script. It's really a listening exercise. And we think that part of what we're helping the client to do is to develop and to draw on and to develop their own sort of natural problem-solving skills because, there may be another housing crisis in the future. We know that we're helping folks, and unfortunately we're returning them to often very unstable housing situations. So we know that these crises will come up, and we're hoping that this is also sort of modeling a process by which clients can in the future use this approach themselves to avoid a future homeless crisis. So overall now that we've implemented this at the front door, we've been able to successfully divert 400 families from either having to go into shelter or a prolonged wait for a housing referral. And that represents about 36% of the total families that have come to us through coordinated entry. This is since October of 2014, so more than, not quite 2 years. And what we're finding is that through diversion, folks, the majority of folks are able to reestablish their rental. Some folks are doubling up, some folks are in shared housing, a few folks are relocating, and we're still at about a 5% return rate. As I said, we've opened this up to all populations. The folks that are, the two agencies that are operating our coordinated entry have more, deeper experience with families, and so we're learning kind of what translates to single adults and households without children and what doesn't. So we don't see yet the same. This data was, I think, as of June. So we're not quite seeing yet the success with singles and households without children, but we are optimistic that we'll be able to start to see better results there. So just in closing, in Pierce County, we've definitely made a commitment to a systemic embrace of this problem-solving approach. It's, as I said, at the front door of our coordinated entry, and it's really getting woven throughout our agency's approach to crisis resolution. We really think that this is critical to having an effective crisis response system, especially when for the foreseeable future we see that we're not going to have enough resources to rehouse every person who's experiencing homelessness in our county. So for that reason, every conversation with clients is focused on a quick resolution Every conversation is creative. And we just we think it's more than a promising practice. We think it's, for us, it's becoming a best practice in how we implement our crisis response system. So, Jeff, back to you.
Tess, that is wonderful. Thank you. I want to put a plug in for this this webinar model. The whole idea of this model is that the webinars, this monthly webinar, is that we can have a dialogue amongst the CHG lead grantees. So I want to invite you to either raise your hand on your GoToWebinar dashboard or type in a question into the question or chat box. I can monitor those from here. I want to kick off that question. We have a few minutes for Q&A. Tess, do you happen to know off the top of your head what the hearth measure is, the target measure for returns to homelessness? You said you're at 5%. Do you know what the hearth measure is?
That's a really good question. I don't off the top of my head. I will say,
I don't either.
Ironically, our outcomes from diversion in terms of returns to homelessness are slightly better than, not slightly actually, they're significantly better than they are with our rapid rehousing program, which we are scratching our heads about. So our rapid rehousing is closer to 15%. And what I've seen from national data is 15% seems to be kind of where returns are nationally. And I think most folks are tracking returns from rapid rehousing at that point.
Yeah, right. So at 5%, even though it might be comparing apples to oranges, it's really significantly better than kind of the national standard at this point.
Yeah, and I have a little theory about that, which is I think that the folks who are basically opting into having this 30-day light touch case management approach are probably those folks who might have self-resolved on their own over time. We're just giving them a kickstart to do it. So yeah. I suspect that they are among all families and individuals who are homeless. Obviously, there are high barriers to reestablishing housing, but I'm suspecting that they're probably among the lower barrier folk within that category.
Got it. And Sam from Cowlitz County writes in to say that the hearth measure, I knew somebody out there would know it, the hearth measure for returns to homelessness is 5%, and the goal is to be under that. So you're right at that threshold, probably leading the pack, I imagine, in Washington State.
Yeah, just on
Tess, you touched on what I think is the head of the nail, which is about homeless prevention being most effective when you provide it to the people who ultimately would have otherwise gone homeless. And you talked about the difficulty of finding the predictive indicators. What can you share with the group about what you've learned about predictive indicators of those who may go homeless?
Yeah, I don't know that we've learned anything else other than what the research tells all of us, which is that there aren't any that predictably that will help us determine who's going to become homeless. So, for example, folks often point to prior participation in the foster care system as being a predictive indicator, and it may be. There certainly is a higher. There's a relatively high prevalence of youth. So let me put this another way. There's a relatively high prevalence of people who have aged out of the foster care system among youth and young adult homeless. So about 40% of young adults who are homeless had prior contact with the foster care system, but that's still 4 out of 10, which if you were to take 10 folks from the foster care system and give them prevention services, your batting average is still not really great in terms of being able to capture those who absolutely will become homeless.
Right.
There's nothing, there's nothing about mental health that is predictive. There's nothing about substance use. It's all the things that I think commonly people associate with factors that contribute to homelessness. There's no one of those that that reliably will always result, or even high 80–90% average result of being able to select who might become homeless.
Right. I know it's been a conundrum for everybody that's been trying to figure out what that magic bullet is, and there just isn't really one, is there?
Yeah, no, I mean, there was a study that was just produced actually earlier this month out of Chicago, and they looked at data in Chicago from 2012 to 2014. They had a really big sampling, and really what they came up with was the closer you get to the homeless crisis, the more successful the prevention is, which feels like a duh moment, like, well, duh, if you're homeless, then,
right?
But that's because obviously the more upstream you are, the it's just quite simply more of a crapshoot, frankly.
Right. And just before we switch over to Caleb down in Cowlitz County, Tess, I was wanting to ask both you and Caleb if you would mind sharing your presentations with the audience. If you can send them to me, I'd be willing to distribute them out to the group.
Yeah, absolutely.
Okay, great. So I want to give the audience one last opportunity to pose some questions to Tess. Not seeing anything coming in. Caleb, are you on the line?
I am. Can you hear me?
I can. So stand by. Let me make you the presenter. Okay, the audience will soon see your screen. There it is. Okay. Caleb Luther with Love Overwhelming in Cowlitz County. Take it away.
Thanks, Jeff. Well, the first thing I should say is that Tess's presentation, we did this together at the state conference back in May, and her presentation is really very, very similar to this story in Cowlitz County. So a lot of the same data. I mean, we have different populations, but the story is very, very similar. So really, hopefully, what I do is support what she was saying, especially how things began with prevention and how that became really overwhelming and sucked the money out real fast. A lot of the data is the same. Our move towards diversion and crisis resolution practices is the same. So, yeah, we run coordinated entry here, and that was really also what gave us the data we needed to find out. So, you can see my title slide is Kicking and Screaming, because I was actually one of the people who was against moving to more rapid rehousing and focusing on the homeless population and moving away from prevention. So that's one of the reasons I was asked to present at the state conference, was because I was one of the people opposed to it and then kind of had a turnaround change of heart. So my view is often called the 10,000-foot view, where I have a supervisory role and I can see kind of what is going on system-wide. So that's a good perspective, but I'm close enough to the ground where I can see what's happening on the ground. So that was the view I was able to get through coordinated entry. So I'm going to meetings with other agencies and hearing what they're saying, what they want to move towards and their opinions, but then I'm also seeing how it works on the ground as we were getting coordinated entry up and running in Cowlitz County. And so I started hearing this voice. It was mainly the voice of Michael Torres, who was in Cowlitz at the time. He was at Lower Columbia CAP, which is the CHG grantee here. And he's now in Clark County. He might be on this call for all I know, but he was the first voice I heard that said we should not be doing prevention, and we should be moving away and focusing on the homeless population. And that, if you've been entrenched in doing prevention and you are not used to that, hearing that, and haven't seen the results, you might react like I reacted, and I was like, that cannot be right. That does not make any sense. And so one of the things he said was that the greatest predictor of homelessness is that he's just a really well-researched person and is always looking into that, what's going on around the country and what the research says. And he said the greatest predictor of homelessness is a history of homelessness, if they've been homeless before. So Tess talked a little bit about, like, what are the predictors? Is there that one out there that says, oh yeah, they're going to become homeless because of X. And there really isn't. And so the one that he was saying and talking about was if they've had a history of homelessness in the past. So we've started just doing prevention for people who had a history of homelessness within the last 15 years. And that really didn't change much. There was a move from doing mostly prevention to doing less prevention and more of the rapid rehousing for the homeless population, and that those percentages, the prevention percentage went down, and we started doing more and more, and they eventually flip-flopped, and we were doing mostly rapid rehousing. But this was still kind of our thought. If we're going to give somebody prevention, let's filter it through this predictor. There was also this voice of most people will self-resolve, which is very difficult to quantify and hard to know if they will. It was a great point from Tess that you just don't know who will and who won't. There's just too many factors, and it's almost impossible to know what's going to happen. Sometimes the people who seem to be in the highest level of crisis will self-resolve suddenly, and sometimes the people who you think are going to self-resolve do not. So the idea was that most people will self-resolve. So these are the things I was hearing, and to be honest with you, not believing at first. But then there was one fact that was there, which was the same people were returning every year when prevention opened. The money came through and the funding was there, and we started screening people and sending them, and it was the same people who had gotten prevention the year before. Like, oh wait, they're just coming around every year relying on this rather than it being actually a saving them from homelessness. So those are some of the things that were happening. The opposition, the voices in my own head and some outside of it, was that this would create more homelessness. So I'll talk about what actually happened in a little bit. But that was the main thing, which is what you hear. This is going to increase the number of homeless individuals and families in our county. Tess mentioned going upstream. Shouldn't we be going further upstream and preventing this, because an ounce of prevention is worth a pound of cure, right? So that made sense to me, and I said, yeah, we should be going further upstream. But then it was draining our resources very quickly, and we didn't know if we were giving the assistance to people who actually would have needed it or wouldn't have. One of my questions was, are other counties really doing this? And so I realized, as I started to change my thinking, I realized it would be foolish not to look at other counties who are actually reducing the number of homeless in their county and doing some other things, really good things. So Pierce County was one of those. Looking at Spokane and some others, we looked outward instead of just saying this is the way we've done it, and we realized that the counties on the cutting edge, really making an impact, were lowering their prevention assistance and moving towards housing people experiencing homelessness. There was a little pushback even from when we presented this. Tess and I and a couple others presented at the state conference in May, as I mentioned, and there was even pushback during the question and answer time of that. And there was some people who were saying, well, we have really targeted prevention, targeted it in these specific ways, and it's made a big difference, and we've tracked, it's very hard to track whether prevention was going to work or not, and what happened. As you can see, Tess mentioned they lost contact with a third of their folks, and that's the same here. There's just not the staff to follow up and know what happened, how are you doing? Did you self-resolve or not? Did the prevention we provided, the assistance we provided you, did that work? So there was some pushback even there where they were saying that they had better data on that it worked and that it did prevent homelessness. But usually, my answer to that is that usually when I hear from people who are still in favor of doing a lot of prevention, they don't talk a lot about diversion, and they don't talk a lot about the housing, counseling, crisis response, which is what we have moved into and what Tess mentioned as well. So I thought that was an important thing to bring up today. So the changes we made, eventually we became 100% rapid rehousing with our CHG and ESG provider here in Cowlitz. And we prioritized unsheltered. That's what we've been doing this year. Unsheltered families, to be specific. We were part of the 100-day challenge trying to reduce unsheltered family homelessness in our county. And with 2 other counties, and all 3 counties were very successful at it. It was a great idea and just a great program, and we've continued a lot of the practices from it. But that's where we're at. We're doing 100% rapid rehousing, assisting people who are homeless. So then it was like, well, are we just going to leave everybody who is at risk of homelessness to their own devices and, hope for the best? And so we decided that we would try to fill in some of the gaps. And one of the ways we did that was with the life skills program. We called it homelessness prevention. It's a just-in-time life skills program. And I think I heard Tess mention that a little bit, where you want to teach people how to self-resolve, enable them to self-resolve, assist them, empower them, come alongside of them with that housing, counseling, crisis response mindset. And these are skills that they will use for the rest of their lives and teach others to do as well. So rather than just saying, here's some financial assistance, if there is going to be some prevention assistance, when it looks like this, it has great success, and we've seen that here in Cowlitz. The other was providing diversion. So really the life skills program is also a diversion program as well. And sometimes that diversion is financial. And the good thing about diversion is they're much, much closer to possibly becoming homeless if we provide it. So we only provide diversion to someone who's at risk if they are definitely leaving their primary residence. So they have a court-ordered eviction notice. We know they're going to go, and we do a lot of diversion counseling. If it's like a last minute and we know that they do not have anywhere to go, they're headed for shelter or the street, we may provide a little diversion financial assistance to divert them from the system. That's also for newly homeless individuals and families as well, to keep them at a shelter. One of the things we did was our local Salvation Army had been providing prevention assistance for years. It was very tight requirements, like it had to be $300 or less of the current month's rent. You couldn't owe any back rent, couldn't be used for anything else. So very few people qualified for it. We were able to convince them and just show them that it would be better to move into diversion assistance with their funds. So now there's currently no cap on that, and it's all for new housing. So we can send a few families there, a few households there each month, and get people into new housing. They actually cannot pay deposit, so the only thing we can do with that is pay part of the first month's rent, and then the person will have to come up with a deposit themselves. So that's been great. Successful rather than providing prevention. They're on board. We have some local churches that we were able to get on board with an emergency needs grant, and that's really an untapped resource. A lot of churches have people come into them who are in crisis, and the church doesn't know what to do with them. They don't usually have a screening tool. They don't know what they just kind of go with their gut, usually give them a tiny bit of assistance. So we said, if you as a church would give toward this fund, we'll do all the screening, make sure that this is the best use. We'll do a lot of other counseling, housing counseling, crisis response ahead of time, and then we'll provide diversion with the funds that you provide into new housing. And churches love that. We take away their need to screen, and they have somewhere to send people to. So we have a number of churches in county on board with that. It's been really successful. I think we housed 20-something households last year with that, and we're on track to do about 30 this year, just from local churches giving to this fund. And I mentioned this already, the housing counseling crisis response, which is really in line with what they're doing in Pierce and what Tess mentioned with the how to respond to people who are at risk or feel like they're at risk. Maybe they have a notice from their landlord. Just making sense of what kind of notice it is can do wonders. And so the word missing from that slide right there that I should have put in here is de-escalation. Because if we can get people to calm down, tell us what's going on, what kind of notice do you have, what's happening, have you spoken to your landlord, let's get that conversation going. They start to find solutions themselves, and sky's the limit with creativity. It's amazing what people can come up with. And this has happened time and time again. If we can just be a voice of calm, reassurance, and listening, and trying to think of ideas with them, and of course giving them some resource navigation, that housing counseling. But a lot of times it's just some landlord mediation. Buy some time for you. Let's get a conversation going with your landlord. Let's look at other resources. And they will often self-resolve. It's amazing how often it is. So the outcome was that they are self-resolving. We were able to fill in the gaps and say, well, we don't want to just leave everybody who's at risk of homelessness out there to fend for themselves. So let's do the life skills thing and provide some diversion. And what I was most surprised is that this actually does work. So my presentation is a little bit more anecdotal, obviously, kind of story-driven, and Tess is very heavy on data, which is great. But here's some data for you, what we know so far. In prevention, in the life skills program, 75% of them are new to the program every month. So we average 100 and something unduplicated households calling for help with prevention. They're usually just calling for rental assistance. That's what they're wondering. Is there any funds for this? 75% of them are new. We've never served them before in that program. So that's significant in a number of ways. Seeing that they are brand new, we often don't have a history with them, and so we can kind of start from scratch. So these are people that have not been taught the life skills, and we haven't assisted through that before. It also means that a lot of the people who were in the program before or connected with us before aren't calling back. 5% approximately, and this number is going up, which is encouraging because we're getting better and we're finding other resources. 5% are prevented just by having a conversation with people, just by brainstorming and listening. There's a huge population that we lose contact with. We just do not have the staff and the program capacity to know what happened to everybody. But for the definite, like we know what happened to you, 5% are prevented, 5% are diverted. Those numbers sound low, but the next number is that 65% don't request services again. Now that's not a hard stat, like, oh, well, we know they self-resolved, but we do know, anybody operating court entry knows that if people are in crisis and need your assistance, they are calling. They are finding you. They're coming by and calling in the same day twice. They are beating down our doors and ringing the phone off the hook to get something. And we also train our staff heavily to say, call back, stay in contact. We want to know if anything changes, even the slightest thing. And so people do. They are matched up with a staff member who sticks with them. So month to month, this is consistent. 65 are not calling back the next month. They're not requesting services again from us. So that is a positive. Like I said, it's not a hard stat like we know they've self-resolved, but it is a positive thing. But really the best predictor of is what we're doing working or is it causing more homelessness is to look at the overall picture, which is positive in Cowlitz County. We can see that when we stopped doing prevention, we didn't have this sudden huge spike in homelessness and say, oh no, what are we doing, you know. We've seen it consistent across the board, lowering homelessness over the last 10 years, and then in the last few years we have not seen this huge jump. So that overall picture is what's important. And that's all I have. I think we're going to have some time for questions, which I'd be happy to try to answer.
Caleb, great presentation, and there's just so many questions that swirl around in my head. It's hard to know where to start, but I want to speak on behalf of Rob-Anna, who is in Clarkston. I was just visiting with yesterday, as a matter of fact. She's got a couple of questions. One is about your life skills program. She asks, is your life skills program teaching clients how to use conflict resolution? If not, what do you teach in that program? Can you speak to that?
Yeah, that's a great question. Yes, conflict resolution, landlord mediation, is how to talk to your landlord is huge. That's probably the #1 thing that prevents homelessness that's just my instinct. I don't have the data on that, but that's time and time again as I've worked with clients and helped build this program. before I started coordinating it, that's what did it. Now, we don't market the program as a life skills program to clients. So we don't say, would you like to be in a life skills program where we help teach you the life skills you need to succeed? You know, we don't market it like that. We basically kind of say, do you know, there isn't any rental assistance out there for you, so there's no funding. So let's have the next part of the conversation, which is I'd like to come alongside you and just help you prevent homelessness in other ways. Let's just talk through. I have some questions. We do an assessment. Is that something you'd be interested in? We might be able to be successful with it. And some people say, no, forget it, and hang up because there's no funding for them. A lot of people say yes. And so conflict resolution, that was a good question. Absolutely number one.
So will love overwhelming staff, or staff in any of the service providers for that matter, actually initiate conversations with landlords, or is it up to the client to do all of that? In other words, will there be a mediator in the form of a case manager to help clients that may have had not great relationships with their landlords start a conversation about how to get right with the landlord again? Will you provide assistance to a client that way?
Yes. Yeah, it's case by case, very much client-centered. You know, what do you want me to do for you? We can sign a release. We can do a conference call right now with you in the office here, or I can go with you and we can go to the realty company or the private landlord and we can talk. Sometimes that really helps to have kind of, I'm going to be your advocate, but we work very hard not to come across the landlord as if we're here because you're the problem, you're a bad landlord, you're not doing, you know, we're here to advocate for the client. We come across as a impartial mediator, and that's very important. Because some of these landlords are housing some of our other clients, and some of these landlords are people we want to house some of our clients. So we need to be the landlord's friend as well, which is really cool. We have landlords referring people to the program because it's expensive to evict someone, and they don't want the lack of rent if the unit goes without a tenant for a few months. So yeah, case by case, we'll say, we'll talk to your landlord with you, or we could write a letter saying, hey, here's what happened in the past. Now here's what they're going to do to not fall behind again. And that's very helpful.
Well, you kind of walked right into Robana's second question, and this is actually addressed to both you and Tess. It's about finding landlords. Robana is in Asotin County in the town of Clarkston, Lewiston and Clarkston. And there, like almost everywhere else in the country, I suppose, there is a shortage of willing landlords. What have you done to find landlords who are willing to rent to your clients, especially in a climate where landlords have so many options for tenants? How do you successfully recruit landlords willing to work in your programs and persuade them to rent to your clients?
That's a good question.
Big question, I know.
I'll shoot for it first, and then Tess can answer. We've tried a lot of different things. It is a landlord market here in Cowlitz, no doubt about it.
Right.
Like you said, they have a choice a lot of times between a number of people. So building relationships is huge. Giving them, having success with a client is awesome. Helping prevent an eviction can work because they see that they did not have to evict someone and pay for that eviction and all that, go through the court. There's outreach things you can do to find landlords, events and advertisements and things like that. I know we talk about this every week, and the meeting's actually today where we're going to talk about this in Cowlitz and how can we reach out to more landlords? How can we engage in more landlords? It's so hard. So I don't have probably any fresher ideas than any other county is trying right now.
Tess, do you have anything to say about that?
Yeah, Caleb, I mean, I think you're absolutely right. There's no one secret sauce for this. We do everything you do. We do targeted outreach. We do landlord recognition, human nature. People like to be thanked for, you know, kind of going above and beyond what they feel like they have to do. We do a lot of coaching with the clients as well, so that when they're talking to landlords, they're not leading with the crisis end of this, right? So they're not leading with, well, I just got evicted and here's everything else, but they're, you know, sort of leading with how, why they're motivated to be good tenants and what they understand about being a good tenant. We find that when landlords hear a client actually expressing to the landlord that, hey, I understand this is a business for you and you want rent paid on time, and I'll make sure that your rent is paid on time. Those sorts of things, that helps. And the other thing is we tell clients not to hide the fact that there's going to be blurred, there's going to be, you know, dings on their credit history, but to be upfront about that and talk about what they're doing, you know, to resolve or to change things. And so that we find that coaching of the clients really helps. We also find that a lot of landlords respond really positively to knowing that there's case management, so that if it looks like the tenancy is going to go sideways, that the landlord has someone other than just the client, other than just their tenant, to reach out to. Because at Caleb, you're right, one of the things that they are trying to avoid is the expense of turnover, of high turnover. So whether that's the expense of eviction or just the expense of the normal turn on a unit, they're, you know, this is a profit business for them, so they want to know that this rental agreement is going to be good for, you know, whatever period of time. So yeah, I think it's a combination of both cultivating and working with landlords, but also really paying attention to clients and how clients interact with landlords.
Great points, and I know that my colleagues and I make the point on a regular basis that landlords are the greatest ally that service providers can have. So having, you know, forging and maintaining those strong relationships with landlords is such a critical part of this whole process. I want to put a call out one last time to our audience members who are listening in. If you have a question, go ahead and type it into your questions panel or raise your hand and I can unmute you so you can ask the question yourselves. Presenters, any parting messages that you want to share with the audience?
Not really, just thank you. Thanks for letting me be a part of this. And I think there's a lot of voices probably out there in the county that are working really hard and trying to figure out the best way to do it. So go easy on yourself and keep listening to what other counties are doing. And yeah.
Yep.
This is Tess. I totally agree. I mean, I think counties, particularly staff and county governments, we all tend to be a little bit risk averse because we know we're stewarding public funds. And in this case, the crisis is such that I feel like innovation and a little bit of risk taking, you know, while also monitoring the outcomes, is the way that we're going to try and figure out the best solution.
And that part about taking some risk really rings true for me too, Tess. You know, I think because the crisis is kind of at the magnitude that it is, taking some risk in the offhand chance of learning something really powerful completely seems worth it at this point in time. And the alternative is to let a lot of people go homeless. So taking some risk and trying to find better ways, it's the way to go. Thanks for being bold, both Caleb and Tess, and thank you for joining me. I want to ask again that you send me your presentations so that I can distribute them out to the group. And thank you so much. We'll see you again.
Thank you.
Thanks. Bye, everybody.